So we're going to have a panel discussion today on climate change and One Health. And the way that the panel will unfold is that each panelist has a slide where they will introduce themselves and then tell you about their work. Then they also have 5 questions that they've been asked to reflect upon, and we will answer those questions after you have a chance to talk about your slides. We also have some questions that were submitted at the time of registration that our panelists haven't heard yet, so we'll have a good opportunity to just brainstorm and dialogue around the issue of climate change. And then if there are additional questions that come up in the chat towards the end, then we will also respond to those. So without further ado, we'll pull up the first slide. And I think it's in order of Dr. Gus Engman. Is that correct?
Yes.
Great. And Dr. Engman has a, yep, there you go.
All right, well, good afternoon, everyone. Again, Dr. Gus Engman, and I'm a relatively new assistant professor in the Department of Forestry, Wildlife, and Fisheries. And so I've been here just over a year. It's been real interesting to start your career as a professor through COVID. And so I think it's appropriate, given that we're in this talking about One Health here. And so primarily my research is focused throughout my career is focused on anthropogenic impacts to aquatic ecosystems and aquatic ecosystem health. And I've got, three kind of drivers that I've focused on up there: dams and associated human water use, extraction of water, urbanization, and climate change. And, I study how all 3 of these impacts and their interactions affect aquatic habitats. And then in turn, I've focused largely on studying fish communities and the biotic interactions. So kind of how all these things interact has been my career focus. And studying fish communities is a really good way to understand aquatic ecosystem health, because we often use them as indicators of overall aquatic ecosystem health. They're relatively long-lived, so they tend to integrate impacts, things like pollution that might happen in a moment's time through their lives. And they're also really important for human health if you think about just in terms of recreational fishing for kind of the mental health and physical aspects. I should mention that I mostly study freshwater fishes. And so freshwater fishes are really important for food security in a lot of areas of the world and provide a lot of important micronutrients. Like some places, people get vitamin A is like a really important thing from fish eyes, where people actually eat fish whole. And then I've also done some research on how fishes could potentially impact human health in a negative way through studying contaminants contained in fish tissues, things like mercury. And so, I think that they all kind of are connected. And again, one of the things that I've really studied with in terms of climate change is how precipitation patterns are changing, both also with temperature, but primarily precipitation patterns, and how that again interacts with things like dams and human water use, and how that could potentially be a threat in the future. And so, but since coming to UT, I've actually kind of expanded my research into new areas and started studying freshwater mussels, which has been really exciting. And I'm working with Dr. Michelle Dennis, who's here in the room today, from the College of Veterinary Medicine. And we have a project studying, we're trying to understand these mass mortalities of freshwater mussels that are happening in the Clinch River, which is like a global biodiversity hotspot for freshwater mussels. And freshwater mussels are extremely important for aquatic ecosystem health. And the cool catchphrase we like to use for them is to call them the livers of the river, because they're filter feeders, and so they'll filter out pollutants and they'll clean the water. So it's a really important ecosystem service. But the Clinch River has many mussel species, but it also has some of the most imperiled mussel species, and there's some mass mortalities going on. And so our project is studying how the interaction of possible climate drivers and a potential disease driver in causing those mortalities. So So it's been exciting to be here, and I think that's all I got for now.
Thank you. Now we have Dr. Kate Evans.
Thank you.
Yes.
Thanks for the opportunity to let me speak on this panel. This is my first hybrid meeting, which is weird, but we'll make it work. I am now a science manager, so I'm not doing as much science as I used to, but I'll tell you what I have been doing and where I'm still connecting. So I'm currently division director for the Computational Sciences and Engineering Division. The benefit of this is that we do computational sciences across many areas. So we include health sciences, materials, chemistry, earth, all the different sort of sciences that use high performance computing at Oak Ridge in there. And so I get to see interdisciplinary connections. So for example, connecting health with climate change, with urban sciences and transportation, and all the different things that you could think of when you're talking about these kinds of problems. So that has been one benefit of being over sort of a multidisciplinary science area. So my background is to study large scale weather systems, how they form, how they decay, how well we characterize them, and then also looking at numerical methods. In other words, to make these models more accurate at scale. So when we run these models with very high resolution at the scales that we need to look at things like health impacts, looking at how to make those models faster and more accurate. And in doing so, then moving more into sort of validation of models. How do we know that the model is creating the best data that we can, the most accurate data, and how well do we know the answer? So if you're a fisheries professor, for example, you want to know how accurate is that climate data that he's getting from us? How much uncertainty do we have? And so how well can we characterize what's going on? Where can I use it? That sort of thing. So connecting to other places there. And so obviously that creates interesting science for climate impacts. So taking our climate model data and weather model data and using that for things like the health of people, say during wildfires. I'll let Josh talk about that more. Things like how people, how they're doing in cities, and particularly during weather extremes. So the picture lower right of my slide, I'm sort of turned around here, shows how the apparent temperature has been increasing. So not only has the temperature been going up during climate change, but also the humidity. And during health extremes, that's very taxing on the human body to have to deal with heat and humidity. And so studying that at the scales where we can look at things sort of at a county or city level is really important for health impacts. Also looking at things like energy use, how the power usage and the type of power that we use will change. And then also working with folks like at NIMBIOS to look at disease propagation. And, if you have more rain in one area, how will diseases propagate differently and things like that. So using that climate data at high resolution to look at the impacts such as health and other things. I think that does it. Thank you so much.
Thank you. That's wonderful. Exciting. And the next presenter we have is Dr. Christina Kinseiger.
Hi, thank you for inviting me to be on this panel. I am an assistant professor in the Department of Public Health. This is my 6th year, so I have been here for a while. I come to UT from public health practice, actually. So I worked for the Florida Department of Health for a number of years with the Environmental Public Health Tracking Program and the Building Resilience Against Climate Effects program, both CDC funded projects that were being done in Florida. And I continue to work with them on a regular basis in the realm of environmental health. I'm an environmental epidemiologist. My research focuses on the impacts of climate on human health and disaster epidemiology, so natural and biological disasters. Because I have that academic and practice relationship there, a lot of my research is focused on evidence-based practice. So how can I, as a researcher, help improve public health practice, public health preparedness? So a lot of my current research is focused around that research to practice area. And so some of the things that I am interested in are understanding the vulnerabilities and the current and future disease burden associated with climate change. So understanding what makes some of our populations more socially, more medically vulnerable to the impacts of climate change and other disasters. And then understanding, how weather and climate are currently impacting human health, as well as based on climate projections, what we can expect in the future to better help our policymaking and our public health planning and preparedness activities. Also, looking at methods for developing stable and reliable sub-county indicators for some of our environmental health drivers, some of the health outcomes associated with negative environmental impacts, life expectancy, things like that. And then finally looking at better ways to measure at the micro scale, human environment interactions. So some of my current projects are related to improving public health preparedness to some of these events by incorporating interdisciplinary methods from people. I'm collaborating with engineers and some colleagues in nursing to develop engineering-based models to help improve rural health related preparedness for biologic and natural disasters. Also have a project funded with colleagues in geography and in social work, looking at the urban heat island and specific vulnerable populations related to that, such as those who are underhoused or experiencing homelessness. And I continue to consult with Florida Department of Health and other practitioners for helping them, incorporate climate science and climate models into public health practice, because it's, those fields are very different, and sometimes it's hard to incorporate the different types of data that we have in both fields and to make it into a useful framework. Thank you.
Thank you, Dr. Kintziger. Is that right? Kintziger. All right. And next we have Dr. Joshua Fu.
My name is Dr. Joshua Fu. I'm a professor in civil environmental engineering. My primary starting my studies water quality and air quality, and now later on is climate change, or link each other. So my currently mainly two directions. One is to improve or reduce uncertainty of the climate model, which is introduce the chemistry interactions into the Earth system models. This is one of my directions. Another direction is to the climate impacts, which is we utilize all the climate model and air quality model, water quality models to provide the details to the final resolutions. For instance, we can down to the 1 kilometers resolution for health effect study in Colorado. So this is one of the demands from the different communities, from water resources, water quality, and human health. Need to have a fine resolution data. And how we gonna get there? This is a very challenging. From the currently this week is a COP26 in Glasgow, England. UK. So this is the one of we trying to our best to reach the better quality of data to provide different communities. And also, I serve the World Meteorological Organization's new initiative called the Model Measurement Fusion for Total Global Atmospheric Depositions. This is very important for the following 20 years study, because that will impact to the water and the food communities, and which is a very largest challenge in this century. Also, I developed the integration and the hybrid approaches for the AI and artificial intelligence and the machine learnings, and how to utilize those the data, the huge data set like a petascale data sets, how to find out those useful and better quality to provide the communities to use those data for their assessment. And also I work on another direction, like I say, the climate change impacts on energy infrastructures. We utilize a fine resolution for the energy power grids infrastructures study when the extreme event coming in, like hurricanes. So we did some case study in Katrina's cases in New Orleans areas. And also for the heat wave, flood and drought I would like to emphasize the heat waves. Currently, we find out the ticks is brewing because heat waves. So it causes all the pets or animals and then transmitted to the human's health. This is one of the study is ongoing. Also, as I said, this first I focus on is to improve the climate. So we developed the chemistry solvers into the Earth system models. This is maybe the field study on that. So we are going to improve the Earth system model as a more complex interactions from the chemistry reactions in the atmosphere. The last one is I present this very important the future directions in the National Academy of Science, Engineering, and Medicine last year, how to integrate engineering and the Earth systems science together. So we have a climate model, how we're gonna transform those models results to the engineering, because engineering to get a solution or the strategies or the mitigation for the climate change impacts. So this is very important, the future direction, how to integrate the two huge community together. So we need to have a bridge between the two communities, so we can resolve or solve or mitigate climate change caused impacts, and then we can adapt or resilience. Even we can really solve our problem somehow to meet the net zero carbon emission in 2050s. This is one of the future directions. So these are what I think I have a lot of the things to say, but I will stop here. Thank you.
Thank you so much. And then finally, we have Dr. Sindhu Jagadamma.
Well, thanks for this opportunity from UT One Health Initiative. I am so grateful for that opportunity. I am an assistant professor of soil science at UT Institute of Agriculture. I received my bachelor's degree in agricultural sciences from India and my master's and PhD in soil science from the Ohio State University. After that, I joined Oak Ridge National Lab as a postdoctoral researcher. I worked with Dr. Melanie Mays and Dr. Terry Hazen before joining UTIA in 2016. See, the overall goal of my research program is to promote sustainable soil management, to increase crop productivity, and also to mitigate climate change. So soil management is very important because world soils can store, actually it stores 2,500 billion tons of carbon, which is 3 times the amount of carbon atmosphere stores and also atmosphere contains, and also 2 times the amount of carbon vegetation stores. So it's a big deal. So we need to do whatever we can to keep that carbon in the soil in order to reduce the greenhouse gas emissions, thus to mitigate climate change. So to achieve this overarching goal, we have several focus areas in my research program. One is to actually assess soil health in terrestrial systems, in particular managed agroecosystems, heavily managed agroecosystems. So like how important human health is, soil's health is also very important. But testing soil health is not as straightforward as testing human health. So this is one focus area of my research program. And second, we consider soil as a system. So we wanted to understand how the soil component is interacting with the other components of the system, such as plants, microbes, climate, and environmental factors. So altogether, how these different components interact so that we can sequester more carbon in the soil, thus to improve the soil health. And also we are interested in the mechanisms behind the long-term sequestration of carbon in the soils. So in order to do that, we do some foundational research in my lab to actually quantify and characterize soil organic matter or soil organic carbon, as well as to understand its stability and its distribution in the soil, and loss from the soil. So this research topic has far-reaching implications because based on how we manage our soil, it can be a blessing or it can be a curse to climate solutions. So finally, I wanted to emphasize that soil health is an integral component of One Health. We heard a lot about animal health, human health, forest health in the morning from different speakers. But I wanted to emphasize that soil is the basis for plant growth, thus for food production. So a healthy soil is very important for healthy food, and which can support a healthy human and healthy animals. That's all I have. Thank you.
Thank you very much. It's great to have all of you here. And we'll start now with the series of questions that you had in advance. And we'll just go straight down the line and then we'll alternate. So we'll start this time with Dr. Engman, and then the next question, I'll surprise you, but we'll start at the end with Dr. Jagadamma. The first question is, what do you see as the largest threats of climate change, especially related to your individual research interests?
Okay. So this again is pretty specific to my research interests, but changing precipitation patterns are something that that I think about a lot, and it's especially in freshwater systems and rivers, it's extremely widespread. Pretty much all rivers in the world are expected to have changes to what we call their flow regime, which is kind of an intuitive term. It's the the kind of pattern of how much water is flowing through that river over time. And so it's really widespread, and it's somewhat hard to control. It's not like with temperature in streams, we can mitigate that directly to some extent with things like riparian shading or something. You might plant trees to shade the stream. And so these changes in droughts and floods are a really large issue, and you can think about how that could, even on the landscape, these changes in droughts would cause things like fires, and that could have down impacts to freshwater systems. And then there's also, especially when you're concerned about droughts, or there's this sort of feedback with some of the other drivers that I study, where if we're in a time where we're scarce on water, people are going to win. Again, I think a lot about aquatic communities, and so if we're scarce on drinking water, then we're always going to prioritize people having that water over the fish or the bugs in the streams. And so think about how this could, there's all kinds of impacts to life histories and interactions with communities in streams. But think about the kind of the One Health thing is that when, especially in the case of drought or even floods, when animals are stressed because of these changes in precipitation patterns and changes in flow patterns, they might become more susceptible to other stressors, to things like disease. And there's lots of other factors, things like changes in the algal community composition can impact the entire water quality of the stream, and that might happen again because of these changes in precipitation patterns. So that's something I think about. So
can I ask you a little follow-up, Dr. Engman? So what would you say is the largest of all of that you just shared? Which one keeps you up at night? Which is the one that is the most concerning to you?
Well, like I said, just changes to precipitation patterns, but I mean, I guess, these places that are experiencing these extreme droughts really, really worry me because, like, for example, the Colorado River already doesn't flow all the way to the ocean anymore. And so that's a huge change because we take out so much water for agriculture, and I mean, that can really, obviously if a stream runs out of water, it's not a stream anymore, right? So that really worries me, those droughts.
Thank you so much.
Yeah.
Yes. So we'll just go down the line. Thanks.
I could say he stole my answer because I'm going to talk about not fish, but heat waves. So
Yeah.
from a meteorological perspective, the biggest event that hurts people's health is actually heat waves. I mean, we see that a lot of the press goes to tornadoes and hurricanes and storms, but in fact, these large domes of hot air, which happen because of changes in the large scale weather patterns that happen. When you think about global warming, the greenhouse effect insulates the earth. It makes it more uniform in temperature. And so that changes the flow patterns that go around the earth. And so that changes these big weather systems that come in and how long they stick around. And so when you talk about these long droughts, we know that that's going to change going forward. And we have to understand, are they going to last longer? Will they be more humid, less humid? And that has huge impacts for human health as well as the food that they eat and the plants that grow. So
Thank you.
for that.
Well, she stole my
Right,
answer.
speaking of heat. Right.
Speaking of
Right.
heat, yes.
Because I learned a new term with you, this urban heat island you mentioned, yes.
Yes. Okay. So well, if we look at like the biggest direct impacts on like mortality, it would be storms that you mentioned and precipitation type events like flooding. But the runner up to that is heat. And I would argue that heat also has a bigger impact on a more indirect pathway to human health. And that's through, not only just heat related illness, but also cardiovascular impacts, renal impacts, things like that, and even mental health impacts. And so I would argue that heat is the one that keeps me up at night. We are seeing increasing temperatures globally, and then we also have this urban heat island effect, which is basically where urban areas are experiencing higher temperatures than the surrounding rural areas because of our impervious surfaces, because of less green space and things like that in the city. And so and also just the air can get trapped. There's not as much, breeze, or depending on, where the urban area is. And so our vulnerable populations in the cities, in inner cities with, lower income housing, homeless populations, they are going to experience heat very differently than people that live in our newer buildings that have better cooling and infrastructure, and have better capabilities of adapting to heat. So that is one of the things that we're looking at.
Yes, thank you so much. Yeah, appreciate that. I also love to see people of different disciplines nodding when, somebody else says something like, oh yeah, that's really true. Yeah, I saw a lot of that. Dr. Fu.
I can add that the heat islands, especially for the low income people, and all they cannot pay the energy bills, especially the COVID-19. And this year, actually, we have a heat wave in Europe, and last year too. So we can have a more frequent heat waves. Those cause the heat islands problems, and those low income people, well, one is cannot pay the bills, even they have air conditioning. So air conditioning will less usage. So that causes their, their public health, human health. So they will go to the, one is like they have accessibility to the hospital or the clinic. So this causes a lot of problems because of climate change. And earlier, we just published one paper earlier this year. We looked at the 2050, the middle of the centuries, how the climate change impact to the urban areas, which is in the buildings. So I just talk about the low income people. How about the general public? It will cause those efficiency of the HVAC systems, how to adapt the climate change caused by the urban heat islands. So this is what you have maybe pay more bills. So this is what energy and power grids impacts those how the demand and supplies. And because before is going up gradually and now it's going down. So how do those utility company to how to deal with those allocation of their powers. So this is the one cause the problems. But another problem, recent study find out the rural area people. We're talking about just urban, right? We talk about rural area peoples. And those peoples, their accessibility to the hospital is not as same as in the urban areas, people living in the urban area. So they have accessibility because of climate change and cause that, like heat waves as well. So these are all the problems. It's gradually to spread different communities, no matter what levels of your income levels. So these are widely to impact our human with wealthy, healthy life. So this is one I would like to add. Yeah.
Thank you. And how about soil?
As an agricultural scientist, I am actually worried about the impact of climate change on agricultural sector in particular, both globally and locally. The mean increase in mean annual temperatures and also occurrence of more frequent and severe extreme events like drought and flood, it can decrease the crop production and also the livestock production. So, so the statistics show that 60% of the world population depend on agriculture for living. So this impact, this negative impact can directly affect the 60% of the population. And it can also affect the other 40% in terms of shortage of high quality food and also increase in food prices. So, so I worry about this occurrence of more frequent and intense extreme events. And we experienced this a few months ago because we have a organic grain production field experiment here in East Tennessee. So it was my first year, our first year of the experiment. We had a good crop stand in May and June. And then in July, we did not have any rainfall. So that water stress during that critical growth stage of the crop, heavily damaged the crop. And soon after that, there was this intense rain for more than a week. So that brought in a lot of pests and disease problems. So, it's our organic system, so we can't control those issues with pesticides or other chemicals. So, we had a complete crop failure. So, I was talking to a producer near Nashville. He also grows corn and soybean organically. He had a complete crop failure too. So these kind of this is real and we see locally and we talk about the global implication, but we see around us. So this actually concerns me.
Okay, so hang on to the microphone and we're going to switch it up. So after you answer, you get to choose the next person on the panel to go. Okay, so you answer and then you give the microphone to who you want to answer the next. Okay. Each of you will do that. So the next question is, what are the mitigation strategies that exist to prevent or slow the problems you are observing? So you've all shared problems. And so what is working or what are you all working on to slow these problems from occurring?
Yeah, as a soil scientist, I wanted to emphasize what we can do to keep that 2,500 billion tons of carbon in the soil. So in the past, there was a lot of soil mismanagement. So you might have heard words like intensive tillage, over application of fertilizers and other chemicals. These practices actually caused a lot of soil degradation. So because of that, there was a lot of greenhouse gas emissions, and also that created, enhanced the climate change problems. So we can focus on soil-centric approaches to find solution for these problems. So these approaches include, these are natural approaches, these include like no tillage or reduced tillage or growing cover crops during fallow season or when the main crop is not on the ground. So we can grow some cover crops. And also we can rotate several crops instead of growing one crop every year. And another option is to at least replace little bit of chemical fertilizers with organic sources. And also we can integrate crop and livestock farming together. With all these practices, we can definitely reduce the greenhouse gas emission and keep that at least that 2,500 billion tons of carbon in the soil. Maybe we can add more. And I don't know how many of you heard that Tennessee is #1 in the nation in the nation for adopting no tillage. So our 80% of croplands are under no tillage. So it is number one. So that means that our producers are doing a good job in curbing these greenhouse gas emissions. But we are challenged with, like, the Tennessee and also the entire southern region is uniquely challenged with warm and humid climatic condition and also poor soil types. So we need to do more than just adopting no tillage to, deal with this problem and also to improve the soil health.
Thank you. Now who's next?
Christian, right?
That's good.
Okay, so I thought a lot about how to answer this question, and I'm going to kind of not answer it. In public health, we deal more with adaptation than mitigation. And so adaptation is really focused more on how can we respond to the climate change that's already in the pipeline, we're already experiencing. So how can we reduce our vulnerabilities or increase our resilience? And so at the larger scale, I think one thing that public health can do and is doing is really focusing on improving our information systems and our early warning systems around the climate change impacts on human health. So we don't have, any really specific surveillance systems focused on most of our health outcomes associated with climate change, like injury, like heat-related illness. It's not, those are not like notifiable diseases. And so we are working with, hospital administration data sets and things like that to understand those types of health outcomes. But we are working more closely with our environmental information systems to try to start integrating those into one network, if you will. So like, for example, some of my colleagues around the country are introducing like air pollution data and climate data or weather data into their syndromic surveillance system so that they can monitor both the environmental impacts as well as what's happening, in our hospitals with chief complaint data. We also have public health practitioners around the country working with their National Weather Service offices to better understand what the local area thresholds are for the health impacts from heat and extreme temperatures, and understanding like the different thresholds for the different types of vulnerabilities to the effects of heat. So elderly, children playing sports outside, the homeless are low-income housing populations that are affected by heat. So to better tailor our messaging and our communication to get the information out. And then on the more local level, we're implementing, evidence-based interventions and adaptation projects. One quick example, again, related to heat is I think New York City is doing this Be a Buddy program, having the local community work with experts in public health and climate change and weather to improve the community's resilience to the effects of heat and extreme temperatures. And the Be a Buddy aspect is, partnering with people that are more vulnerable to heat to help get them to the cooling centers or get them water when they need, or help them, pay their bills for their electricity to run their air conditioners when they need it, or their heating systems when they need it.
Thank you.
And I will
Pass it to.
All right, thank you. She partially stole my answer, but also I have a couple options. If we are thinking about like mitigation, again, I'm just gonna stick with my precipitation theme and just say that we as humans can be so much more efficient with our water use. We irrigate fields, we just kind of spray it all over the place. Our default storage for water is like an open reservoir where there's all this evaporation. We're flushing down our toilets, literally. And so, we could be more efficient with water use, and that would down the line help with all these drought effects that we're talking about. But also, I agree with what Kristen said that sometimes we need to not think about mitigating or resisting these changes that are happening with climate change, because they are going to happen, and there's really not much we can do about it to some extent. And so something I've been thinking about is a lot recently with some colleagues is directing change in ecosystems that we know we expect to go through these changes. And one example we give is we're worried about coral reefs, for example, just being wiped out by combinations of disease and bleaching and all this because of temperature change. But what we're observing is some of these coral reefs are creeping poleward, and so we could think about really actually facilitating those changes. And one of our speakers talked about things like assisted migration. So those are some strategies that I think could be useful to not always just try to fight the changes, but to actually, and that's kind of a scary thought for some people, but to kind of facilitate some of these changes in ways that we think are best for, think about biodiversity or ecosystem function.
I will say in my line of work, I'm a social worker. There's a concept which is what you resist persists. And so y'all are tapping into that a little bit. Just how do we, instead of just saying no, how do we adapt?
Yeah.
So those are I just learned a lot. Thanks for what you shared. Yeah.
Oh, no problem.
Who goes next? Yes.
So being in the atmosphere where all the trouble started, sorry about that. There's sort of two main strategies. There isn't really mitigation. You can either take the carbon out, which I think is the best plan because having it not in the atmosphere solves all the problems you guys are talking about. And then the other thing is geoengineering, which I'm not a fan of. And I'm a fan of doing the research in it. So Dr. Fu does some of this, and I think it's critical that we understand what the impacts are, because I don't know that we'll ever get to a point where we really understand all the impacts of not only adding lots of carbon to the atmosphere, but adding something else to try and negate that. It just feels like you're painting over a bad color with another bad color. So I'm personally of the strategy that we should develop technologies as soon as possible, if not yesterday, to take carbon out of the atmosphere. This is sort of touching on things I don't do myself, obviously, but I think starting with actually trying to remove some of that might be our best strategy to at least prevent some of the things that we know are coming, at least from the atmosphere standpoint. So it's nice that we're talking next to each other so you can pick up the ball and talk more about that side of it too.
Yeah, I have two ways to control
Okay.
or mitigate, like Dr. Evans just mentioned, the geoengineering. So two ways. One is how is under the current climate until 2050. So another one is how to slow down the climate change. These are two ways. So two different ways, different control strategies. One is geoengineering. One is to under current climate and how to cool the upper air or the atmosphere temperatures. Because we are warming because CO2 emissions hanging there, 410 ppm CO2 concentrations. So how are we gonna cool down upper airs? This is one of geoengineering can contribute. But the reality is another question, yeah. But this is one solutions to cool down. And another one is how to solve the current problem is one is based on the engineering perspectives, how to change in the building code to adapt to these climate changes. For instance, in the coastal lines, they have a more tide surge, stone surge, and cause a flood along the coastal lines. So those houses always be in the flooded, and they pay a lot of bills on that. It's $1 billion lost. And how are we gonna mitigate that? So maybe changing the engineering code for those future new home or the improve the current homes. The second direction, how to slow down the climate change is carbon recycle, recovery, and reuse. This is currently talking about to develop technology to doing this now. And how are we gonna to reduce that to another one is this COP26 talk about agreements. All the countries have a forest, don't touch it. Don't minimize the forest in their own countries. So this is one agreement now is discussed in COP26. Why? Because if we want to have a negative carbon emissions, only rely on the agriculture, forest, those are natures, soil and oceans to sink or to absorb the CO2 concentrations. So this we call a negative carbon emissions. So this is one of the following 10 or 20 years we are going to do that. One of the technologies called air captures is another one. Air captures to capture the CO2 emissions in the atmosphere and using the one of filters to absorb the CO2 concentration. This is another one, but it's very costly. So these are all the solutions. 2 ways we need to do work on that parallels. It's working at the same times. So hopefully we can, in the end of the century, so we can down from 400 ppm. Some prediction is going to if we are still keep the using fossil fuel, we are going to 800 ppm of CO2 concentration, even 1,000. How to reduce that for the current CO2 emission or CO2 concentration in the atmosphere? We need to parallels doing that. So another solution we are working on, as I serve in the Arctic Council, we call the MAP programs. It's Arctic Measurement Assessment Program. We just have a presentation this morning, and in the COP26. Another solution is because the CO2 is a long life climate forces. So how about the short life? So you have a 2 curve to increase or the total the temperature codes, the rising temperature cause the pollutants. So we are focused on the methane and the black carbons, which is making the short life climate forces. If we reduce that, so we can see the effects in the following 10 years. If we control CO2 today, we won't see any changes of the temperatures in the following 10 years. It takes decades or centuries. So the short life climate force is one of solutions currently we are going to do at this moment, especially for Arctic area, because Arctic region now is melting, as you know. The polar bear is nowhere to go. So they're losing their home and they were coming to inlands. So all not only the polar bear, all the marine and crossfield species and community will be changed. Even in Alaska, because the ice cap of the glaciers, they melt, and those are village in the water. So they need to move to another places, means relocations. Those are problems, and also their interstate or highways, it's built on the ice cap. It's melting is sunk. So every infrastructure is all damaged now. So how we gonna slow down the global warming or the typical somewhere is warmings, and these are one of parallel solutions we need to deal with.
Thank you. Thank you. So we do have 3 additional questions that you all were presented. However, at this point, I'd like to see if there are any questions in the room or anybody that is joining us via Zoom. If you have any burning questions that you'd like to make sure that the panel responds to, I think we'll be able to address the last 3 that you were asked to reflect on. But at this point, I just want to make sure that in case anybody wants to participate, we have space for that. Yeah, so apologies if it is addressed at a later time. What can individuals do to help mitigate the effects of climate change? And that's related to one of our additional questions, like what strategies would you use to inspire individuals to take action around climate change as scientists?
My thought is that, whatever our expertise is, we can do something, maybe as an environmental activist to like varying degrees, to address these environmental concerns. For example, like if I think about my stand, I don't get to do a lot of outreach or extension activities, but a lot of my colleagues do. So they interact with the stakeholders and producers on daily basis. But my job appointment requires me to do a lot of lab scale and field scale experiments and publish those. But maybe I can take those publications and translate those to some materials which are more interesting and accessible to our stakeholders and our general public, so that we can translate whatever we are finding from our lab or field-based research to those who are actually making the changes on the ground.
Yes. But one question I have is, what do I do? Like, if you were going to give me advice, we were in the grocery store and I heard that you studied soil science, and I was interested in how can I contribute to helping our world stay healthy? What would you tell me to do?
Yeah, I may ask you if you have a small garden and how much you till,
Yes.
That's my first question. And if you say that, yeah, I do that every day to control weeds and everything. So I may give you some solutions. How can you work around and reduce that tillage?
Okay.
So, that's one simple example.
Okay, that's great. Dr. Engman, you have something I can see.
So I think that individual solutions are great. And, I think we've been kind of sold on the idea of, all of us should walk more and get an electric vehicle. And I think that's a great idea, but people, I think, need to start looking a little bit bigger. And I don't know if this is through voting or petitions or whatever, but I think we need to basically demand of leaders broader change. And so it's not a very specific example or answer, but I really do think that that's what's going on, that there's a lot of changes that could have been happening, and there's a lot of people who are resisting those changes from happening, or people, or maybe large organizations. And so we need to just find a way to kind of push back against those, and not, a lot of people feel really guilty, oh man, I drove too far, or I used the plastic straw. And great, let's all try to practice those practices personally. But if you spend you can spend a lot of time focusing on what you're doing as an individual, and you could actually put that energy into these kind of broader changes, to push for broader changes. So
yes. And if you were to choose a broader change, you're the king of the universe, you were going to choose a broader change, which would be the one you would say?
Well, I guess it's just reducing our fossil fuel emissions, right? I think we should all be utilizing electric vehicles right now, and I think we could be. But that, again, it's not because people aren't choosing to. I just think that there's kind of a pushback against it, and using other sources of energy for industry, and that would reduce those emissions, and that's obviously the core driver.
Right.
Yeah.
But I definitely hear what your point is that we have individual decisions that we make every day. And you're saying that sometimes can be like a straw man's argument, that we actually have to have large systemic change and put our energy towards these large systemic change issues.
Yeah.
And for you, fossil fuels is the one.
Sure. Yeah.
Cool. All right, cool. Yes.
And I'll add education. One thing you can do personally is make sure that your educational system is teaching everybody climate change is something we can understand. It's not trivial, but if you can go through and explain why it's happening, and then the solutions, both explain the issue, but also solutions. People don't want to just hear that the earth is going to destroy itself, but that there's a way to fix it. I think that's the key.
Yes, thank you. Anybody else have a comment to this one? Yes.
Well, I just wanted to say I agree with what everybody has said. From a health aspect, that some things that we can do as individuals would be to just improve our overall health, because it's our underlying conditions that sometimes make us more vulnerable to the impacts of climate change. And then also, this has never been more apparent than in the middle of a pandemic, but improving our social networks to increase our mental health resiliency can also benefit us after the effects of climate-related disaster. The mental health impacts are pretty profound, and so having a social network, social support system can be very helpful as well.
Yes, these masks things. I'm a mammal. I want to see you smiling. It's hard. It's really hard. Yeah. Thank you. Go ahead, please.
United Nations have we call the Sustainable Development Goals. So they have a very good guidelines And if we can utilize, actually UT now is utilize that and promote that to our students now. And we hope we can have those can be widely to the high school student, or maybe even in the elementary schools starting that. I have actually a presentation in the high school, the West schools. And also students, they are very interested about how to protect this environment. If you tell the kids, they like that. And then they can tell the parents, hey, you need to do that.
Yes.
And maybe this is one strategy to go to those younger people and the communities to start. And also another one is how to help them to understand the waste minimization, how important it is. Because waste why we have a waste? Because we cause a lot of CO2 emissions because of manufacturing for that. So we need to have those young kids since they are very young, and then when they grow up, they carry all the mindset. And then we're doing the next generation, they were going to that because these are cultural things. And it's not easy it's not a one day or overnight solutions. It takes a while, but I believe we get there. We will get there, yeah.
So are you all, one of the questions, was about hope. The question specifically was, do you feel largely hopeful or hopeless about adapting to the future in the face of climate change? And what do you recommend to people who do feel hopeless? Yeah. So where are you on that continuum of hope to hopeless? And where would you say, how would you help people that are very helpless? Go ahead.
I still have a high hope on that. I do not have a hopeless, but only the time is slow. It's slowing. It's not like we want to change in that cultures, like I just mentioned, overnight. But I still keep a hope because even we do not join in the COP21 Paris agreement to reduce our CO2 emissions, but our national CO2 emissions is going down. If you look at the EPA's the chart to present to Congress, our CO2 on the nationwide is going down slowly. It's very slowly, but the trend is going down. But that means a lot of the industries, they volunteer doing that to reduce their CO2 emission in their process during the manufacturing. So I still think if we have, because currently we control CO2, we do not have regulations yet. So if we don't have regulations, no guidelines to do that. It's not like air quality or water quality have a standards, and we have a goal to meet the standards. So I think I still have a high hope we will gradually to get there.
Thank you.
And I also agree with you. I also have a great hope because we have more scientific knowledge now than before about the seriousness of the problem. And also we have some potential solutions and support to do some actions. So these are all reasons to be hopeful. I wanted to go back to the agricultural sector, and where, like I mentioned earlier, we have soil-centric or climate-smart options available, and most of our farming communities already adopting at least one or two of those. So we just need to do more work to increase that awareness so that these practices can be widely adopted. So I found a literature which shows that globally, if producers adopt these better soil management practices, they can mitigate 8 billion tons of carbon per year, which is a great number. So that tells me that we have all the reasons to be hopeful. So so you asked a question about what do you recommend to people who feel hopeless. I wanted to say to those people to stay hopeful and be informed about the knowledge we are gathering, and also do what you can to educate your people around to your extent possible. And at the end, and also try to reduce the carbon footprint, as much as you can by taking mini steps like carpooling or things like that.
Thank you. Yes.
I think whether I feel hopeless or hopeful depends on the day. Like you were saying earlier, I feel like, really what needs to happen is our leaders need to be focused on this change, and we need funding to modify our infrastructure, to do the research. And I feel like that pendulum swings like every couple years. And then on the hopeless side, I guess, being a public health scientist, a public health practitioner, I'm feeling a little less hopeful right now because of the general public's pushback against science through this pandemic. And so even though our science is improving, I don't know that they're listening in general. So that is on the side of hopelessness. But on the hopeful side, I do feel like our younger generation, they are more activists. They're more prone to activism. And I think that with respect to, climate change, that seems to be a big focus. So that does give me hope. So I don't want to end on a negative note there.
Thank you. Anybody else want to comment on this one?
So I'm just gonna, for whether I'm hopeful or hopeless, focus on kind of my areas. And well, one is lead that with that. I consider myself an optimist generally, so I'll say I'm hopeful. But I study ecosystems and animal communities, and I've studied a lot of other anthropogenic impacts. And what I found is they're surprisingly resilient. Like life finds a way, and so things might look different in the future, but you don't want to start. The worst thing you can start thinking is, oh, there's no value left in that anymore just because it's a little bit different. And so I think, I'm hopeful that hopefully we can maintain some of the things we have, but I also think that even if things are a little different in the future, they're still going to be really valuable to us. And, ecosystems are still going to function and exist, and animal communities might get kind of rearranged. But a lot of times what you see with really large impacts is there are some, extinctions of animals, but a lot of times you just see kind of this weird rearrangement of communities, which again, it's not necessarily ideal, but it's just different. And then going back to, what people can do if you feel hopeless is, I think again, to, start a petition, write your senator or representative, participate in a lawsuit, whatever you need to do. But I think we need to, again, really push for our leaders to kind of stand up on these things.
Mm-hmm. Right. Very good. So one question that we want to make sure that we give you an opportunity to respond to, and you've touched on it a little bit, but I want to ask it one more time, is, what role should scientists have as environmental activists? And what are the ways that you speak to people who maybe don't understand the urgency of the climate crisis? So yeah, to what degree how does that fall in your bailiwick of your daily work as scientists?
All right. I started my career not wanting to connect science to activism. I felt like it's my job to say, this is the science. And then now I could be me picking up the ball as taxpayer activist and say, I have these opinions, but I do want to separate my own science results from what people do with them to some degree. But more recently, I see that there is a way to convey to people, and there's an educational opportunity. I learned this on the soccer field. when
Nice.
people are talking about things and you say, oh, well, actually, I do that for a living. And let me tell you why we think this. And you can use them in ways that are not threatening, and you can educate the public in a way that's maybe more, hey, I'm one of you and I think this, and consider this. And also being, we work with climate, but a lot of us climate scientists started the world in meteorology. I mean, climate science wasn't nearly something you studied back in the olden days as you do now. And so talking about the weather, which everyone can understand, that's really the key, is understanding, my plants grow a little earlier than they used to. And my, these things, and you say, yeah, actually that's true. And here's why, and connecting those things which people can relate to every day to something. I guess I've evolved a little bit in becoming more connected, but I do as much as possible like to say, here's the science, and let others who are professionals at the policy say, based on that, this is where we want to invest our money. I have opinions as a personal, educated, taxpayer citizen, but I do like to separate them to some degree.
Yes.
When I currently serve the World Meteorological Organizations, and the new concept just released recently this year, we change into how we're gonna use the science results for the services.
Yes, I saw that on your slide, science for service.
Right.
Yes.
So this is all the organization changing, reorganize their directions. We do a lot of the science research. How are we gonna transform those research to the services, which is services to our sister organizations such as WHO, FAO, or even the WTO trade organizations. So this is how we gonna transform those science results to the services, and utilize those results to our daily life. And also, I mentioned earlier how to integrate the engineering and the Earth system sciences together. How we're gonna utilize those data to engineering solutions. And this is mainly the one trend, or what we are going to these directions, because eventually we still need to solve the problem. Not only the phenomena, only we need to have a solutions, and people are eager to have a solutions to changing our life, have a less impacts. So this is the one I would say, the bridging science to the services. We need to have more people doing that, and this needs the manpower as well. And this is going to be a globally goal for that. For the next decade.
Thank you.
I'd like to agree with you. I started off my career just thinking I want to do good science, leave the policy to other people, but they really do go hand in hand. I've seen, just in the last few years, work that I was directly involved with, like implement very small policy changes, like a health impact assessment we worked on. A policy change was to require that wastewater management treatment facilities, just basically raise their electrical panels like above the flood zone, so that in the event of a flood, they didn't have to shut down because, the power went out. I mean, something simple like that, to having, states and local jurisdictions incorporate health into climate adaptation plans. And so I think as a scientist, you really have to see how your work is going to influence policy and serve as an expert in that capacity to make change. And I also think that as a scientist, we also have the requirement to educate. And so something that we teach in our program is how to use cultural humility to get the message to the populations that you need to get the message to. And something that we did when we were, working on climate and health in Florida was to create these touchstone summaries of the climate impacts on human health by basically, going back to examples of I mean, you wouldn't think of this, but like a winter storm in Florida that led to snow and power outages, and like pulling newspaper articles about like how that directly impacted their community, and like just making it tangible and personal really does help communicate to that person who's resistant to the, even just the idea that the climate is changing.
Anybody else? Yes.
Yeah, I also agree that, we need to step out of our office at least once in a while and try to connect with the general public or other stakeholders, because otherwise, how do they know the cool research we are doing? And people like me are not very good at doing that, but I think we all have to try. And personally, I would like to make a better effort to connect soil and people, because that connection has been kind of lost, and we need to reestablish that to achieve this whole One Health for all.
Thank you. I actually have a follow-up question to that. So, Dr. Engman, you said that mussels are like liver for the river. And I'm curious, what would be the metaphor for soil? Like, what is the metaphor of soil? Like, mussels are liver to the river. Is there like another way of understanding soil?
Soil is the heart of the One Health or human health.
Yes. Yeah. I think that's a valuable question. You know, the use of metaphor to help lots of different disciplines understand, because we can get so detailed in our particular science because we're so good at it. Sometimes we have a hard time communicating across. Yeah. So I loved that. So
I didn't come up with that, by the way, though. So I'm not taking credit for
you
it.
can't take credit for it,
I
but
just liked it.
yeah, but I learned it. Where did you hear it?
Actually, first from a PhD student, we were doing our PhDs at the same time. She was studying mussels, and I think she got it from somewhere. I don't know who first coined that term.
So
but
it's an urban myth of mussels.
Yeah.
If you can have that.
I'll come up with something cool for next time.
Okay, sorry to put you on the spot.
I was really impressed. That's what I was like, man.
Good.
I didn't come up with that.
Actually, soil is sort of the cleaner of our air and our water. You know, soil is the liver for everything else.
We usually say it's the backbone of agriculture, but I think it is more than that.
Yeah. So you're saying that mussels are liver for the water, but soil is the liver for everything else. It cleans everything else, including water too.
Absolutely, yeah.
Okay, so mussels don't have the corner on the market of being the liver.
No.
So those of you that are in the room, I'm just curious, before we end, are there any burning questions you have or anything that you learned, an aha moment from being with our panel today? And I love awkward silence because I'm a social worker. Go ahead, yes.
Well, I'm
Here.
trying to wrap my mind around all that's going on in climate change, and I'm particularly struck. I did hear that, yes, our younger generations are more activist oriented, but I also see that there's such hopelessness often, which leads to poor mental health. And I wondered if Dr. Kintziger could talk about the connection, because this is, obviously we're talking about health, and I think adults, especially within education and so forth, we have a different sense of resiliency, but the younger generations, especially if their parents are climate deniers or, live in states where their leadership is not leading on this issue, it can be very dismal. And I just wondered if you could speak to the younger generations who are struggling to find mental health resilience.
Yeah, sure. So I think that so I think that one of the things that we've been seeing in climate change arenas is that by educating the younger generation, that you actually can make changes in the older generations, because they take that knowledge home and educate their parents or their extended family. Yes, there's going to be some resistance, but I mean, my advice would just be keep trying. Like any little change that you can get your family to make, like starting them to just recycle one thing at a time, like even if it's just recycle plastics. I mean, that is just one step, and you take another step once you get them on board with that. I mean, so all of those little things, you know, are a place to start and to help you feel like you are doing something, and then get involved in organizations that you, if possible, I mean, even in areas that are less likely to have, you know, active organizations affecting climate change. I mean, 4-H programs are, you know, very STEM focused now, and that's an area that you could get involved with to make change and to educate your community. And you know, simple things like setting up your own Be a Buddy program to reach out to, you know, vulnerable members of your community when there is a threat of flood or a heat event or something like that. So even if you feel hopeless, you can make small changes that do have large impacts on, if not like the grand scale, at least on somebody's life.
I can say some examples. Farmers, they always depends on their grandparents, many generations. And they always feel they can see the weathers from their generations. But currently the climate change causes them to gradually to believe the climate change and not rely on their generation knowledge. Why? For instance, all the total precipitation for a year not changing too much, but the changing is to the concentrate in 1 or 3, 4 days a week. And left of the season is no water, no precipitations. And that causes a different experience of what they have had or have in the generations. That change in their mind. This is why I have a touch base with all the people, they talk about that. So this is a different way to influence the older generations. And particularly is experiencing. If they're experiencing the climate change, they will gradually to believe that. And then maybe will get help. And then rely on all the meteorology data, forecast data, not rely on their own experience. Yeah, they always tell us, hey, I know the next year's what looks like. I know the next 3 months it looks like, but now it's not. Because extreme events cause a difference. So this is my one of the token to share with it.
Well, thank you. Are there any other final comments? We've got about 4 minutes left of our time today. Are there any final comments that any of the panelists want to make, or anybody online, or anybody in face-to-face with us today? Yes, please. Here we go.
Yeah, I was gonna say I'm loud enough.
No, but because of the Zoom, I worry.
So, so I'm originally from Brazil, and you know, when I see different countries meeting in Glasgow and talking about all the goals that they have towards climate change, and you know, I personally don't believe that, you know, whatever Brazil has agreed to, they're going to come through with that, just because, you know, growing up there and knowing how things work on a government level, I just don't believe that's going to happen. And I think that may be the case for lots of countries that are, you know, just sitting out there and making all these promises that they may not be able to keep. So with that being, you know, with that in mind, do you guys think that we need more of a global approach where we have policies that expand on a global level? Or do you think that we're okay with just letting each country run with whatever they think is best for them, and you know, hopefully we're keeping up with the promises?
Thank
you. Okay, I can share with that. I have a project is going on. It's not funded yet, but I already have a 1 year's assessment in Brazil. So you're just talking about regulation, right? But when those farmers, they would like to survive themselves or adapt themselves. For instance, the aflatoxin. aflatoxin is for all the crops, right? So there is a temperature and the relative humidity. So the farmers, they adapted themselves without the government to involve, because this is all they can survive. Well, can I say maybe take it back and survive, like how they can get better for their productions. So this is my experience in your countries, because those are companies we are working on in those farms, because they are huge farms. They are managed by operated by the big company. And those big company, they have their own strategy. Like I say, we do not have a CO2 the regulation at this moment in the countries. We don't have a standard yet. We are going to have a standard, but we haven't standard implemented yet or propagated yet. But our CO2 emissions still is very slowly going down. It's not like going up like this. So I think it's this is a different way. I mean, if you rely on only government, it takes a while. Because legislations you take a debate for different years, and so the company they have their adaptation ways, because they still need to make a profit. So they will do it themselves and support themselves and looking for some help themselves. So.
Does anybody else want to respond to that question before we end?
I do.
Okay, you're so glad. Yay.
Geronimo, you make an excellent point. I really think you do. But I think it's going to be your generation and the generations after you that have got to say, hey, look, we said we would do this and we are going to do it. And I think in the meantime, because as you guys are getting into power, things are still going to be plummeting, right? We've got to have our governments putting money into this to help us fight this. And they've got to see that. And I think maybe if they're kind of forced to do that, like, okay, well, we'll throw some money at this, then it's got to be the people who get that money to use it to make a difference. Because I think if they put money into it, but it kind of, doesn't really do anything, we're not going to see that change. And then your generation and those after you are going to have a tougher time with it. And I really think, though, you guys have good voices and you can really step up and make a difference.
I second that. Rock on. Thank you all so much. I learned so much really from being able to get to connect with you all today. Thank you, everybody that's online. Thank you for the One Health Initiative for pulling all this together.